Now the last aspect, the power of health data, and I will take some example on that. First of all, with weapon. First of all, I mean, it's not new. You know? If you look at that, that's quite an old story. I mean, the crossbow was seen as abomination. And that's interesting because it was already sort of a legal concept. Because basically, abomination means nowadays the Martin's clause. Basically, people have the feeling that something is horrible and should not be applied to people. And at that time, it failed. Because, I mean, after that, they continue to use that. Now it may be a bit different because not only there is the Martin's clause, people say, okay, that's horrible, we should not do that, but also we have support from the epidemiological data. Not only we say it's horrible, but it happened in so different way. That how many people have been affected by that, where it happened. So we have good epidemiological information on the extent of the problem. And that's much powerful tool to use when we negotiate. If you take the example of the landmine, that's a convention from 1980 which say basically how to use landmine and what should be respected in terms of criteria. And obviously, I mean, people who have been in the field know that it's almost impossible to apply that. I mean, just crazy. Now, if you review the story, back in the 80s, the ICRC has 12 hospitals for war wounded in the world. And we have a lot of mine injuries that have been treated in those hospitals. And when the surgical team came back to Geneva for debriefings, they say, we see more and more civilians affected by that. And become a real problem. So then, from this surgical information, we went to epidemiological approach. We have been compiling all the files in the different hospitals and putting all that together and publish. And then we saw graphs, okay, oh my God, so many women, so many children affected by that. And that triggered a reaction of the institution. Say, okay, what can we do? I mean, the law is not applied. The law is not applied. Can we change something? So there are a lot of debate in ICRC, how can we move around and that. And finally, the president of ICRC said, okay, let's propose a ban on landmine. And that was taken over by all international community, all NGO. And then it came to the legal step, which was to change the law. And that was done with the Treaty of Ottawa, which now is ratified by most of the countries, and there are still, I think, about 140 or between 40 and 50 countries have been ratified that. So there are still some who have not ratified that. But that's the way it was going. So you see there is a very close link between surgical and public health approach and the law. In fact, public health allow to change the law. Allowed to change the law. That's the Ottawa Treaty. Now the same with cluster ammunition. That was much more recent. Collection of data made in Kosovo and Lebanon. A diplomatic process to have a certain number of countries which are willing to stop the use of this weapon. And now we are in the legal action because there is a convention which still needs to be ratified by, I think, 10 more countries. It become formally a treaty. So you see that from information at health point, from the point of view to legal action, there is a very direct link, and we have a responsibility into that. I will not mention that, we already mentioned this morning for nuclear weapon. A challenge for the future, biotechnology, tremendous impact on medicine, new drugs, new vaccine. Also, almost a nanorobot, that you can put in the body, you can look on the different cells in the body. I mean, there are huge potential. But unfortunately, also a huge potential for the development of weapons. We can create new virus, totally, from the nucleus, everything, which will be totally out of control. And there was a very good book published some years ago by United Nations. And the title was interesting because in the past, even the book that was this morning in Public Health and War, I wrote also a book called Public Health and War, where we always link, okay, what else can do to mitigate health consequences. But the title of the book of United Nations was Health or War. Now, weapons come to such extent that we will not be able to control the health consequence of the use of some weapon. not only the nuclear weapon, but also all this biological type of warfare which can come up out of this biotechnology. Last point, influence on politics and military strategy. Maybe 3 examples. Economic sanction. There has been a tremendous number of economic sanctions since the Second World War. I think about 52 cases. And all of them had a tremendous impact, not on government, but on population. And that has been demonstrated through public health study, which show increasing mortality, increasing morbidity. That is the case in Iraq. You know, there's a lot of studies have been done in Iraq, for instance, by UNICEF, Harvard, different group, who shows the very important impact of economic embargo on population. And now there is a clear evidence in United Nations that economic embargo never reached its political objective, so they will not be used anymore by United Nations. So you see once more the influence of public health data on, in that case, political strategy. The case of Congo study was done by IRC in Congo, which compares the mortality in areas where you have violence with areas where you don't have violence. And you have almost a double in terms of mortality rate. So then definitely there is a humanitarian crisis. So then one of the key factors was to improve the quality of health services, access to food and so on, what we briefly saw at the beginning of the presentation, but also to improve security. And can go even further than that. Why not to increase money forces to secure the area for the population? So you see, from health data, jumping to military activities. I don't know if that's the right thing to do. Just make the link between public health and military activities and try to influence. The same that the study was conducted by Burnham, my colleague from Hopkins, in Iraq, when they show, the rate of mortality was much higher than official numbers. And that triggered quite a lot of reaction, including from Bush itself. And that was interesting, because what he was criticizing was the method, because it's done on a cluster approach. He was not commenting the result, he was commenting the method. And that can be very dangerous, because if you look at criticizing the method, you avoid to talk about the issue itself, the result of the study. What is important in study? Okay, that's the problem that we put on the table from the public health point of view. Now, it's to you political people to make your mind about that. But if you go one step backwards, okay, yeah, but the method is not good and so on, then you lose the impact of your study. Key message? So to produce data on the health consequence of war in a professional manner, so it cannot be challenged. To participate to your humanitarian diplomatic processes as health professional, we have an input in there. To advocate for change in military strategy, case by case, and to provide evidence for the prohibition of the use and the development of weapons. So that altogether where public health can have an impact, health, people's integrity, military and political activities, and change law according to the dimension of the problem. Okay, thank you.